Good morning and welcome from the Minnesota Department of Human Services.
The Minnesota Department of Education,
and the Minnesota Department of Health.
Across Minnesota, we know that untreated mental health and substance use issues can be a significant barrier to learning and academic success. That's why bringing behavioral health services into schools is so powerful.
Our schools have become more than just places of academic learning. They are central hubs for behavioral health support, crisis management, and community connection. And the role each of you plays in that work is vital.
It is a critical time for us to reverse the current trend in mental well-being. We have seen that mental well-being have been decreasing since 2016, both in the state and nationally. 44% of Minnesota students in grade 8, 9, and 11 reported mental distress in the 2022 Minnesota Student Survey. We also know that Minnesota's youth suicide rate is higher than the national average. And sadly, suicide is actually the second leading cause of deaths in Minnesota among youth and young adults aged 10 through 24.
That's why school-based behavioral health services are such an important part of our foundation. They increase access, support teachers, and strengthen communities. But we still have work to do. Today, only about 61% of school programs across Minnesota have an embedded community mental health provider. That means too many students don't yet have the access they need.
The framework guiding this conference is the whole school, whole community, whole child model. When schools take a whole child approach, we see the benefits: stronger mental health, better academic performance, more family engagement, and healthier school climates. But perhaps most importantly, it reminds us that student well-being doesn't happen in isolation. It takes all of us working together.
A conference like this will help us to get re-energized. It prompts us to identify and implement best strategies. We are always learning that there is much we can and we should do to support families, communities, caregivers, schools, and health professionals.
When students have access to behavioral health resources in schools, they are 6 times more likely to complete treatment compared to community-based settings. That's the kind of impact that changes trajectories, especially for students who have experienced trauma or other adverse experiences. And that's the kind of impact your work is making every day.
We must also care for adults who support them. Emotional wellness is not a luxury, it's foundational. So throughout today and the days ahead, let's challenge ourselves to explore how we can build school systems and cultures that truly prioritize emotional health.
I encourage you to use this gathering both as an opportunity to learn and connect with each other. Share your challenge, celebrate your success, and then ask questions. And more importantly, build a relationship with each other. That is how we move forward together.
By supporting the whole school, whole community, whole child model, you are helping to build a stronger foundation, not just for schools, but for Minnesota's future.
You are not alone in this work. Together, let's reimagine what school behavioral health can look like.
Welcome to the conference. And we are really looking forward to making our state a space where youth can thrive and live healthy lives.
Thank you for being part of this important gathering. We're excited for the learning ahead and grateful for the lasting impact you'll continue to have long after this conference ends. Let's get started.